depression is a common mental illness. It is estimated that it affects 5% of adult population globally. People's expression of depression is very much influenced by their cultural background, beliefs, personal values, and language. I am pleased to be joined by Dr. Abdul Salam, a psychiatrist at Mediclinic City Hospital, Mediclinic Dubai Mall, and Creek Harbour. Nice to have you, Dr. Abdul Salam.
Thank you so much for having me, Dr. Layth, in this very informative and entertaining series.
Okay, thank you. Now, how do we differentiate between somebody who's sad and somebody who is experiencing depression?
Well, I think that's a very important question, because the life itself, the event we pass through the life, you get sad, and that's normal reacting for the whatever stress you have.
Sure.
However, depression, we differentiate whether it's depression or it's just sadness by the intensity of the symptom and actually the duration of symptoms. So both of them, they have to be intense enough to call them depressive symptom, and they have to pass certain duration, which is about 2 weeks, to call them to call the episode as a depressive episode. Really.
Okay, so the diagnosis very much depends on the duration, the intensity, and I guess how much it affects the personal, professional, and social functioning. Okay, and what are the main causes of depression?
See, Dr. Layth, I untraditionally like to categorize the causes of depression into 3 main domains. One of them is the biological domains, one of them is the social domains, and one of them is the psychological domains. And these domains, in fact, they interact with each other. In biological domains, as you know very well, that we have this chemical imbalance in the brain. Any imbalance also for other hormones like thyroid hormones, it can either makes you depressed or makes you anxious, and also the genetics play a big role in the biological domains. Now the social domains is about the life stress, the event we pass through it. Not all of us, we tolerate this event the same. Not all of us, they have the same response to this event. For example, I don't know, financial strains, grief, even at times it could be delivery for a baby. It could lead to some depressive causes or depressive illness. And the last thing is psychological domains, who we are, the trauma in the past, all of that play a role.
Okay, and this is, I guess, why before we treat depression, part of our investigation is to look for any underlying physical condition that can cause depression. Like, as you said, thyroid hormone imbalance, other illnesses that may cause depression.
Indeed, because that will alter your management plan, isn't it? And that's very important for us to do a checkup to rule out what other organic cause could be. And it might be not clear. It might be there is, we might not get all answers from that, but it's important to rule out these illnesses.
How do people know they are depressed? How depression expresses itself?
Well, it's not an easy question. As a psychiatrist, we have this cluster of symptoms, which we define depression as this cluster of symptoms. But we at times we get atypical symptoms. But the most important cluster of symptoms what we have is the core symptom, which is anhedonia, lack of energy, feeling very low. And then you have the other kind of symptoms, which is not eating well, not sleeping well, decrease in libido, and those are what we call it the biological symptom. And then we have some psychological symptom, lack of motivation, lack of energy, lack of concentration, and feeling hopeless, feeling helpless.
Okay, so the symptoms of depression are both psychological and also can be expressed as a physical symptoms. And how common the presence of anxiety with depression?
Well, it is Depression and anxiety goes hand to hand. If you are depressed, you are very likely to be anxious when you are depressed, and vice versa. If you have an anxiety symptom or an anxiety illness and then you get a depressive mood, your anxiety will get worse.
So what is the treatment for depression?
Dr. Layth, if we go back and classify depression to severe depressive disorder, moderate depressive disorder, and mild depressive disorder. So each stage of these, it has a somehow different recommended treatment. For example, starting with the mild depressive episode, we usually tend to rely more on talking therapy, some sort of cognitive behavior therapy or interpersonal therapy, or maybe even a psychodynamic psychotherapy. If things get worse and we went to the moderate depressive illness, then I think medication will play an important role in treating an illness in addition to the therapy. And these medication usually to correct the neurotransmitter or the chemicals in the brain.
My question is, the difference between mild, moderate and severe depression is a matter of how much the symptoms are affecting the patient function. So if somebody is quite depressed, that means that he is unable to leave bed, he is not willing to go to work, he is not talking too much to his family, not looking after himself well. And this is where we need medication to help him.
Indeed, indeed. And this medication, it doesn't only play a role of treatment of the acute episode, but also on the longer term, it play a role of prevention for further episode down the line.
Maintaining recovery and preventing relapse.
Indeed.
Okay. And this takes me to the next question, which is, how long the medication need to start working, or how long the patient will need to see an effect, to see an improvement?
As you know, Dr. Layth, we don't have a magic pill. We don't have things which makes us very happy quickly. So it takes about 2 to 3 weeks really to see an effect. And if there is an effect, then we usually monitor this effect and see whether the illness remitted and if there is no other symptom. But if there is continue to have some symptom and he is partially remitted, then we increase the dose.
And there is only a limit to how much we can increase the dose. So what is the process of patient coming off medication if he is recovered?
I really think it's a very important question, and the answer for that is to reduce the medication gradually after the period of 6 months. And that's actually to aim to do 2 things. One is to prevent relapse. The second thing is really reduce the risk of what we call discontinuation syndrome.
Okay. And could you tell us more about this discontinuation syndrome?
Discontinuation syndrome is a self-limiting, mild symptom of mood swing, rebound, and anxiety, which come after and last for about few days to maximum a week.
Okay. What if the depression goes untreated?
I strongly advise people who experience symptoms of depression, or anyone who observes their loved one having symptom of depression, to seek professional help. It is effective, it is easily available, and it helps people to improve their quality of life.
Dr. Abdul Salam, thank you very much for your time.
Thank you.